Good afternoon, everybody. Thank you for being here. Good to be back. We'll go through the data, kind of give analysis on where we stand, what's in front of us, and then take some questions. Unfortunately, we've lost two more members of our community over the last 24 hours, both in the hospital, both Caucasian males, one in his 70s and one in his 80s. Again, very sorry to their families, and it's just been a very tough week with losing members of the community. And I think it's just a reminder about how this virus attacks and it preys on our most vulnerable. And it's not so much for those of us who are younger about us, it's about everybody we love. So again, we think about these families. Testing, our 7-day average, 5.1%, over 7,600 tests yesterday. We had a day over the weekend where we had over 9,000 tests. That's an amazing amount of testing. We'll get into what are the things we can control with this pandemic and what are the things we can't. But that's something that we've made a conscientious effort to test, not just where we're seeing positive rates increasing, but to test in schools, to test in the community, so that we can go and hunt this virus down wherever it is. Hospitalizations, this is the big issue. This is the big challenge of this part of the pandemic. 228 individuals are in the hospital. This is up 15. We have 15 individuals waiting to be discharged from a hospital back to the nursing home where they live. So again, this was a big issue in the beginning part of the pandemic. This will be an issue moving forward as well because of the number of cases that have come out of nursing homes. There's a direct correlation with a nursing home positive case, which becomes a hospitalization. We want everybody to get better. Once they get better, in order for them to return to a nursing home, they need to test negative. We know that it takes anybody a period of time to test negative once you've had COVID, even if you're recovered or you don't need any hospital assistance anymore. So 15 right now individuals are in a hospital even though they don't need to be in a hospital anymore. So we're working on some solutions with the state on this, and it's difficult because these solutions often involve more staffing, and right now staffing is a challenge in all of our medical facilities. 37 neighbors in the ICU. Please keep these folks in your thoughts and prayers. These are folks obviously who are in need of extra help, specifically respiratory challenges, so we really need to think about them. To date, 12,487 cases, almost 3% of our population. That's 303 new cases since yesterday. Not as many as yesterday. We had 356, so we're down again. The Thanksgiving surge, not as strong as the Halloween surge to date. Let's knock on wood. Hope that's the case moving forward. But again, it's pushing our caseload, which was between 200, 225, 230. Now it looks like the new caseload is going to be between 250, 325 range. And so we'll talk about some of the things that we're doing to meet that challenge. Looking at demographics, who's been impacted: 6,720 female, 5,731 male, 1,900 cases under 19 years of age and 19 and under, 2,786 in their 20s, 1,776 in their 30s, 1,477 in their 40s, 1,756 in their 50s, 1,263 in their 60s, 730 in their 70s, 506 in their 80s, 293 in their 90s. Related to testing, I want to go through this. Symptomatic testing. At the FSHAD, we increased capacity there this week. So today, doing 450 tests up to Later in the week, it will be up to 600, and then next week, it will be up to 1,000. So part of what we can control in government is testing. And why do we want to test? We want to test as many people as we can. You want to have the testing for symptomatic people who are sick, but we want to be out in the community testing as many as we can, because that's how we'll find the virus. Everybody gets stuck on the number of new cases each day. For us, if we're out there proactively on offense trying to find cases, that's good, because then we get to isolate the case, box in the contacts, and really limit that exposure. And so testing, we've done a good job ramping up the testing. And so at Cayuga Medical is our partner at the F-Shed now. Pre-register ongov.net/Cayuga Medical. Again, Monday through Friday, 9 to 1 for that testing. Asymptomatic testing, it's been ongoing 7 days a week at the On Center. Some of our registrations have gone down. So what this is a rapid test. If you're asymptomatic or you have not had a direct exposure, this is a great way to get out, get a test. There's slots available. Again, covid19.ongov.net. That's right here at the On Center. Please take advantage of that. Asymptomatic community testing this week. 6 locations are set up. You can go to our website and register. Again, covid19.ongov.net. Let's look at the locations. Tomorrow, again, this is anybody in the city of Syracuse, Northeast Community Center, Holly Ave. Please, right now we have 100 appointments so far. We have more capacity. So if you're in the Northeast neighborhood specifically, we really want you to go and get tested, but anywhere in the city, please do that. Looking at Wednesday, Southside Innovation Center by Duncan Bright right there, 2610 South Salina Street. Please pre-register and get a test. Again, we're going into neighborhoods because we need to test the data. Some of the data there shows higher positive rates. Those are just really from symptomatic testing, though. So we want to go into these neighborhoods and see if there's asymptomatic cases that we can also identify to get our arms around it. Also, Shove Park in Camillus and Fayetteville Village Hall in Fayetteville on Wednesday. Thursday, Lysander Town Hall in Baldwinsville, New York. And Friday, Salina Town Hall in Liverpool, New York for the town of Salina. So this is all proactive testing in the community that we're doing. covid19.ongov.net, pre-register from 9 to 3. One of the apps that is out there, or text messaging alerts is alert.newyork.gov. If you sign up for a text message, you select Onondaga County. When we have these different information tidbits and we do a reverse 911 call about a testing site in your area, this will pop up on your text messages, which is a valuable tool. Today the governor spoke about some of the changes. The governor's referred to it as a winter plan. Essentially, up till now, everybody's been focused on positivity rates. That's been the way that we've been monitoring progress throughout this. At this point of the process, we've been talking about the ability to treat our sick, hospital rates. I think you heard from the governor today. That's kind of the way the state is pivoting as well. They are talking about what happens with these zones. If you hit 90% capacity, you would essentially go into one of these red zones. Certainly, it talked about if hospital capacity doesn't level off for regions over the next 5 days, essentially the region would be in a yellow zone related to indoor dining. Much of our community is already in a yellow zone, some in an orange zone. So the governor also directed hospitals to add 25% capacity as far as beds go This won't be a challenge for our hospitals. The challenge is not so much beds, it's for staffing. Right now, when you look at our capacity levels, we're getting a report each morning. I think we have over 500 available beds right now, so we're in pretty good shape. Even though we have more COVID cases, overall capacity is still in good shape. This is before the governor's directive to add 25% more beds. So we have the ability to meet the moment at this time, assuming things don't get worse. And this is always an ongoing 24-hour cycle. We have to watch this every 24 hours because as we have seen, if the people who have existing conditions, pre-existing conditions, seniors, and others, this virus impacts you differently, and it can lead to higher hospital rates. Also, the state's going to allow retired medical personnel to reactivate their licenses without paying for fees. This will be good as far as developing a backup volunteer list in the event we do get into hospital surge and other things. With everything, we need to really focus in on our vulnerable, working specifically with our seniors. We received very good news about the nursing homes are going to be vaccinated. The federal government's going to partner with some pharmacies, and the first dose is going to New York. The federal government is going to work with those doses to get our nursing home residents vaccinated. This could be as early as beginning of next week. So this is good news. If you look at what's happening with our loss of life and you look at what's happening with our increased hospitalizations, many of these folks lived in a nursing home or went to the hospital from a nursing home. These are our most vulnerable people, and so this is positive news. So where do we stand and what can we do? As a government, we need to continue to test and trace so we can box in this virus and find the virus. We're increasing testing capacity each week. We continue to do that. We have dedicated even more resources to the health department on tracing and investigations, really. There's two parts of this. There's investigating the case, which our health department does, and then we hand off the information to the contact tracing partnership with New York State and the Bloomberg team. So we basically have taken another 100 employees and have assigned them days this week to the health department so that we can get, as we're identifying these cases, we can get on top of them, to be faster with our investigations so we get information out faster, people into isolation faster, quarantines faster. We can do that. We're going to do that. We can work with our partners on vaccine distribution. We're doing that. We're preparing that with our state partners. We can enforce regulations, and certainly we've been doing that. What we can't do is it's very difficult to enforce social gatherings when they're happening in private residences. And I know we've all talked about this, and we all probably know people who've gotten the virus various ways, but the best way to mitigate the risk to you and your family is to try to have your pods, and even your pod of people can be at risk. My pod was at risk to COVID-19. And then you limit your unnecessary commercial activity. And that's what we're asking you to do, is you can control that. You can control how many times you're going out. Maybe you go out one day and run your errands. You don't go out 3 or 4 different days. We did this in the beginning of this process. Now on the backside, things are different. People are nervous. People are anxious. There's not PPP loans for small businesses. There's not unemployment for other people. The ability just to shut the economy down, like some have suggested, is not there. It probably isn't the best thing for our overall public health either when you look at opioid issues. You look at substance abuse. You look at suicide. We need to find balance as a community, and it's very difficult. And it's probably more difficult now than it was in the beginning. So for perspective, our caseloads, we're staffing up to meet the caseloads. these caseloads could jeopardize our hospital infrastructure. I don't know if they will, but they could. When you look at how are we doing compared to our peers, this isn't where we want to be, but this will answer that question. When you look at the 7-day positive averages of other counties that are large like us, and the large counties in their regions, Erie County at 7.2, that's Buffalo. Monroe County at 7.3, that's Rochester. Westchester County, 6%. Suffolk County on Long Island, 6.1. Nassau County on Long Island, 4.9. Oneida County, our neighbor to our east, 7.7. And Orange County, which is in the Hudson Valley, 7.6. And then Onondaga County, 5.1. So when you look at where we are compared to our peers, we're doing well, but it's just not good enough, right? And so if you looked at us, compared us if we were our own state, we would be the, fifth or sixth best state in the country right now from a positivity rate. But again, even if you're fifth or sixth best, when you look at it this way from a positivity rate, it still doesn't meet the mark if we can't treat our sick. So that's why we need more from all of us to try to flatten this thing out. And we need people to really assess their social activity in this holiday season so we don't see further economic restrictions, and so that we flatten out this spread. We get our arms around the increased caseloads so that we're quarantining faster. So that's kind of our analysis. When you look at it one way, compared to everybody else, we're doing really good. But it's not good enough because it's about treating the sick at this time in this pandemic as we get through the end towards a vaccine distributing. Saying that, we got our cases today as far as our on-center, which is still ongoing, our schools and our civic center testing we did today. We did 153 tests of county employees, 0 positives. In our schools today, we light day on school testing, 420 cases, 1 positive. At the on-center, asymptomatic testing to date, we still have more people getting tested, but to date, 407 tests, 5 positives. So we have 1,000 tests, and we got 6 positives out of our program today. That will get registered into the state system. That will probably reflect in tomorrow's data or the day after. Questions?
So today when Governor Cuomo said that areas will shut down when you reach 90% capacity of the hospitals within 3 weeks, what number of people have to be in the hospitals over that 3-week period for us to fall under that?
So that will be 90% of not today's number, but the 25% additional beds that he's saying you need to prepare for. So if you have 1,600 beds essentially outside of the VA hospital in Onondaga County, you add another 2,500 onto that, so you have 2,000 beds. So essentially you need, 1,800 beds to be taken up. Right now you're looking at probably about 1,100 beds to 1,200 beds total in the county that are taking up. So there's room. If you get to that point, though, before that point, you might run into a staffing issue. So that's when you go to a red zone if you get to 1,800 out of 2,000 beds. But before 1,800, you probably have a different problem, right? You probably don't have nurses, and you run into another issue. So that's a surge scenario we haven't been in since we've had the pandemic, and we're not there right now, but it's a fluid situation. With this virus, nobody wants to get sick, right? But we know if you have a certain demographic and you get sick, you respond better. And then we know if you have a different demographic and you get sick, you don't respond well. What is really bad right now for our hospital numbers, unlike earlier in the year when our hospital numbers went very low, is when you have your 20-year-olds who are getting the virus, they respond better. It doesn't mean they can't get very sick. They can, and they can go into the hospital. But when you have folks in their 70s or 80s who are getting rehabilitating in a nursing home, or you live in a nursing home and you get it, you just have a much different experience, and it's a negative one. So that's the challenge we're seeing now. Is all these nursing home cases we reported last week are turning into hospitalizations, and they're in for a real fight.
Ryan, you talk to the hospitals pretty regularly. Do they have the staff to add 25% to their bed count?
There'll be a challenge if we get to that point where we're staffing the surge beds. That's going to be a challenge. There's no doubt about it.
Are they already recruiting retirees or that kind of thing?
Yeah, and there's communication about the retiree piece is smart. That's a welcome approach from the state. And then there's already, from when you look at the volunteer lists, you look at some of your primary care physicians. These are the types of conversations that are ongoing in the event you need it.
Are you getting any closer to needing to activate Manly as a surge site?
I don't think so. In our conversation today with the hospitals, again, beefing up the beds is not the challenge that they see. It's, okay, if I have another 400, 500 people, who's going to take care of them? And so that's where it is. So right now we think we can probably do that. There's even, some of these hospitals even have facilities that we could probably utilize before you would utilize Manly, but again, it's all staffing now. Everybody, this end of the first wave, when downstate gets hit really hard, we can send down nurses. Other parts of the state can send down medical professionals. Other parts of the country are flying in. Now, again, even though these are numbers of cases we haven't seen before, when you look at our positivity rate, if we were a state, we'd be the 5th or 6th best in the country. And some states aren't that much bigger than us from people's standpoint. So those states that once were giving volunteers now need their own personnel. So this is going to be the real challenge going through the final quarter here.
And it sounds like from what you're saying, what that might come down to is doctors and nurses who don't routinely work in hospitals spending some of their time taking care of hospitals.
Correct. That would be one route that we would certainly lean on, those types of volunteers. And again, the other thing, and again, it's when you look at what can we do, we can mitigate our own social behavior patterns, right? The virus needs a host, and it needs to feed. It goes back to the 6 feet. It can't swim in 6 feet of water. So by distancing, then mask wearing and doing everything we know that has an impact, that will help slow this spread. This is peak conditions for this virus to flourish in. So the realist in me and all of us, we know we're not getting to 20 or 30 or 40 or 50 cases a day anytime soon. It just isn't going to happen. It's about managing the crisis and managing the medical infrastructure and being smart. And anything we can do in our own lives to slow this thing down will have a big impact with the community overall.
Can you say more about the plan to bring in vaccines next week? You said the federal government will be coordinating that?
Yeah, the federal government's going to be coordinating the nursing home distribution, and then the state's working with the hospitals right now that have the ability for the first. Each vaccine has different logistical issues. Some of them have to be in controlled scenarios where you need certain infrastructure. So those hospitals that have that infrastructure will host those vaccines, and then they will identify the most at-risk frontline responders, probably from multiple hospitals and multiple medical facilities in the area, and then that will be a distribution point for that. So some of our hospitals did get contacted last Friday from the state about this phase. I'm not sure how many doses, Tim. I don't have that level of detail at this point that those hospitals will be. But if I think the Pfizer vaccine, you have to keep it in these very cold type freezers. The Moderna vaccine is different. So those hospitals that have those types of, that infrastructure, they'll be the distribution points, not just for their employees, but potentially for other regional employees as well.
And did you say you expect nursing home residents to start being vaccinated next week?
Yeah, potentially, yeah. So the nursing home distribution is going to be led by the federal government. I believe they're partnering with CVS and Walgreens. What that looks like, I don't have the plan yet, but that's what we were told. And again, if you want to look at what's the best news, that's the best news, right? So out of all this is, I mean, these are the residents we're losing every day, and that can't come fast enough. We'll do anything we can to help with that distribution.
Can you just explain a little bit more about if we move into a red zone, our hospital capacity meets that threshold that the governor just imposed today? Really, just what does that mean for Onondaga County? I know dining would be impacted, but you mentioned about how some are still in a yellow and orange zone, so can you just explain that again?
So if you go red, that basically means you can't treat your sick people well enough, right? And so that means all activity needs to slow down except for what is deemed essential. So it's kind of like the beginning where we were in the beginning of this process. So you'll have multiple industries now on the sidelines. And quite frankly, if you don't have hospital beds, it's tough to make an argument why anything should be going on with that, because you can't treat your sick. So that's a real, again, I don't want to get too far ahead of our skis on this one because we're not even close. But this is the challenge of this part of the process. You got the vaccine. You can see the vaccine really helping your most vulnerable in the immediate future here. Those are folks that have bad outcomes with this, and those are folks that have a higher percentage of hospitalizations. So that vaccine should help this tremendously. But again, very hard to have an argument against restrictions when you don't have hospital beds to treat sick people. And it's not just COVID, right? It's anybody that we're talking about.
What's the latest on the businesses that had to close in the orange zone, like the salons and the gyms? When can they reopen?
Yeah, I think that's going to go. Again, this is a call today that I was talking about. Certainly, I think it's worth, and I asked to reassess the orange zone zip codes. Some of these zip codes have been disproportionately impacted by nursing homes. And if you remove that equation, I'm sure they might be yellow, maybe even less. So I've asked for that, and that's a conversation. The state might be a little cautious right now because essentially we're getting our Thanksgiving data right now. There are elevated cases. Some communities are much worse than ours. Some communities went 2-3 times higher than where the caseloads were before. We look like we went maybe 40-50% higher. I think they're saying that's Thanksgiving. You got Christmas, Hanukkah, and Kwanzaa coming up. So what's going to happen with that? So the state may not go reassess this. I'm asking them to reassess it because some of the commercial restrictions I don't think will move the needle whatsoever. I don't think the salon owner, by having them out of business or having them in business, is going to change our positivity rate whatsoever. So I think that we're asking for that. I understand the pressure everybody's under, including the state, because I'm under similar pressure.
You're asking them to reassess zip codes as opposed to reassess the rule that in an orange zone?
Yeah, if they wanted to look at the rule or they wanted to put more restrictions or regulations, that we'd be happy. I mean, one of the things, we have testing every day, right? So if you want to put a testing requirement on these businesses, some of them have testing on the employees already, but if you wanted to say to gyms, you needed to have 20% of your members tested once a week and your positive rate needs to be below a certain percentage, we'll do that. We can do that. We have the infrastructure to do that. Now, every community in the state probably doesn't, Tim, so maybe that's why they don't do that, right? But we would take on that burden because it's not just the business owner that's beating us up on gyms. It's nutrition experts, it's dietitians, it's doctors who say, I'm working 16, 18 hours a day, I need to get a workout in. So it's bigger than just the business owner at this point, although we're very sympathetic to them as well. So we're willing to do what we need to do for some of these other businesses. Look, it's difficult with restaurants. We think some of the orange zones, the data is skewing them, and so technically they should probably be in a yellow zone and have some indoor dining. But when outside of the households and the gatherings, certainly bars were the big driver through Halloween. Now it's shifted because of the regulations on some of these establishments, and now it's more strictly gathering, living room spread.
Just circling back to hospital capacity, I know you said that our hospitals are in fairly good shape right now in terms of bed capacity, not so much with the staffing.
Right.
But so does that mean you're saying that it's unlikely that we'll move to a red zone anytime soon?
Yeah, I don't think we're going to a red zone, Adrian. That again, when you have how many active cases do we got? We have 2,300 active cases. If you stay in that range, we're probably going to stay in the range of hospitalizations we have now. It probably won't get much better. It probably won't get much worse. If we see a surge where instead of 270 to 325 new cases a day, we're looking at 400 to 500 new cases a day, that changes everything, right? So part of this is based off of how many new cases and how fast they come in. Every day there's new hospitalizations. If this was the first wave, we would probably be in big trouble right now because the hospital stays are so much longer. This way, we're getting people into the hospital, getting them the help they need, and they're getting out faster, which has saved this whole system. So our medical professionals are doing really unbelievable work. But if case loads stabilize and go down, this problem goes away, and we have a much stronger argument to make about loosening economic restrictions. If this problem gets worse, we have no argument. That's just the reality of it.
Is the issue of nursing home residents who are now waiting in a hospital to go back to nursing homes, is that becoming kind of a forefront issue again? And what's the likely solution?
So it is. And so what we've asked, today it's 15 people. Just knowing how many cases we had last week, that could be, the number could be double in 3 or 4 days. So we've asked the state to review their current policy. They've looked at us about, because there are COVID units in some of these nursing homes, but there's other nursing home residents in the same building, so currently you can't go back in. So we're looking at strictly COVID unit facility. Is there a way we can put together staffing from multiple entities into one building? We think we've identified potentially a building or two that could work, but we got to find staffing from multiple entities to be able to staff that. And if we can pull that off, we'll go to the state with that plan, and I'm sure we'll get approved quickly. So we're working on that.
That would be like a separate transitional facility.
Correct.
Until they tested positive?
Correct.
You mentioned moving 100 county employees into doing case investigations?
Yep.
Not full-time, they each take
Yeah.
a day, or?
So essentially what it is we're taking, we had a call, I think, over with 100 employees last week, this morning. These are folks that are trained, and now what we're doing is we're managing this out of the executive office and the emergency management office, just like we're managing testing now. And so what we're doing is we're giving the health department on Mondays and Tuesdays, these are your employees that are coming, and they're doing this. It's something that the health department doesn't have to do. And then Wednesdays and Thursdays, you got these employees coming in, and then Friday, Monday, these ones are coming in. So we're basically building up the investigation. Again, we beefed it up to 200 a day. the number is now higher than 200 a day, so we have to continue to rearrange our own deck. And we're identifying the testings. We're doing more testing because we want to find as many cases as we can. I know the flashy headlines every time there's a new high. If there's a new high and there's 9,000 cases, I feel okay. If there's a new high and there's 2,000 cases, I don't feel that great. Because we want to find it. We want to find the virus so we can box it in. That's how we get the positive rate. That's how we get the R factor, which is really how the percentage that a sick person passes it on. So we need to get the R factor down under 1%, where we were in the summertime. And if we can do that, or at least keep it at 1, we know we've flattened the curve. So the only way to do that is we've got to find everybody, and that's what we're trying to do.
It's almost hard to believe, but just 2 months, I mean, in September, we averaged like 15 cases a day.
Yes,
And now it's 275 or 300.
correct.
And each of those cases creates a lot of work for the investigators to find out, who the patient was in contact with. And it's hard to conceive that they're able to keep up with that. Is it getting backed up?
It is backed up. I mean, the whole system's strained. And so by us doing what we're doing, we think we'll be able to meet the 300 level caseload within that 24, 36-hour period of time that we like to be operating on, where we think we're effective, right? And so that, again, when you look at what government can control, and then you look at where the community can be impacted, these are things I can control and I can do. And then it's the community that's going to help us slow it down, though. And then if we get out in front of it and identify it all, and the community's mitigating their own social interactions the way that we've done better than other communities, there's no question. The data will show that, but it's just not, even at this rate, we're in a dangerous territory at this rate.
Ryan, you talked last week about that turkey bowl in Skinny Atlas, and I don't know, were there positive cases that came out of that? Did that play a role in the schools going remote this week?
Yeah, no, I don't know if there was or wasn't positive cases. I think overall, and again, I'm not here to shame people. Just what I think was disappointing with that scenario was we're in a pandemic, and we explained risk, right? And it wasn't like we talked about this for one day and you missed the briefing or the reporting. We asked, we basically are asking the community for help. And even if nothing bad happened from that incident, it's the message that it sent. And again, I'm not trying to pick on kids or traditions. I wish I could have played in my own turkey bowl. Last year I did play in a turkey bowl. But it's right now we need people's help to do this. And I think if you put yourself in the shoes of that nurse or that healthcare professional that is going to be asked to work a double and not see their kids, and maybe even sometimes they have to work more than that, every little thing we do to mitigate this has an impact and it's meaningful. So I think we're going to be out doing a lot of testing in Skinny Atlas, I think tomorrow or Wednesday, and we'll get our arms around that. But that was just something that was caught on social media. I'm sure it happened in lots of areas, but it's the imagery. We're asking for help. Now's the time to help us. Now's the time to come back together again, as hard as this all is. In the beginning, people were really frustrated. There's lockdowns. People are frustrated about when we're going to get going again. We're trying to avoid all that, desperately avoid all that. Help us. Help us.
Just curious, how many times did you get tested during your quarantine?
Twice. Yeah.
The rapid test?
Yes. Yes. Yeah. Other questions?